Hello, ma'am.
Hello, Ganesh sir. Ganesh sir, can you hear me?
Royal,
Yes, sir.
he has to unmute his microphone.
We have informed, sir. Ganesh sir, please join with audio, sir. Please click on that mute button and join with audio. That audio button is there, no? Just click on that and join with audio. Join with computer audio.
Good afternoon, everyone. A very warm welcome to each and everyone present here. Today, we are here to attend an online guest lecture on the topic Impact of Online Learning, Health Issues and Remedies, conducted by Dr. Ganesh Kinney. Before we begin today's event, let us remember the Lord and ask Him to bless us with this meaningful prayer song.
God will make a way where there seems to be no way. He works in ways we cannot see. He will make a way for me. He will be my guide, hold me closely to His side. With love and strength for each new day, He will make a way. He will make a way. Oh, God will make a way where there seems to be no way. He works in ways we cannot see. He will make a way for me. He will be my guide, hold me closely to His side. With love and strength for each new day, He will make a way. He will make a way.
I would like to begin by welcoming all the presidents, secretaries, and members of the Red Cross Association, Computer Animation Association, the Quiz Association, the IT Club Association, the Heritage Club Association, and the Wikipedia Club Association. A special welcome to the president of today's program, the director of the administration block, St. Aloysius College, Mangaluru, Dr. Norbert Lobo. I also welcome today Dr. Ganesh Kinney, Assistant Professor of the Psychiatry Department, Yenepoya, deemed to be university, to this program. A warm welcome to the Director of the Rural Healthcare Development Center, Yenepoya, deemed to be university, Dr. Poonam. Medical Officer, Dr. Srinivas, and other office bearers, Sister Divya and Sister Shrikriti, to the program. I request Dr. Norbert Lobo, the Director of the Administration Block, to give his presidential remark for this online guest lecture.
Thank you, Lorraine. Respected resource person, Dr. Ganesh Kinney, Assistant Professor of Psychiatric Department, Yenepoya deemed to be university. The presidents of all the 6 associations, Mr. Royal, the organizer of this program, and dear students, I'm extremely happy to be part of this guest lecture that is impact of online learning, health issues and remedies. I think during these days, as you know, technology has revolutionized our life and has invaded practically each one's personal life as well as public life. Today, as some experts say, we live in a world called VUCA world, VUCA, that is volatile, uncertain, complex, and ambiguous. I think what is certain today will lose its place or its existence within no time. Dear students, today you have been using some of the forms of technology which 10 years down we never heard about it nor even dreamt about it. Yesterday I was just going through one of the website where I seen one article, the impact of technology on students learning, online learning, published in International Journal of Advertising, which says the stress level among the students as well as among the parents has been increasing in the last couple of months. It is a study conducted in US by the experts. So the study makes it very clearly the impact of the online learning on the young or the younger minds like you. I'm very much impressed to see that almost 300 odd students are joined this webinar, this guest lecture. And I'm not going to waste your time. We have the expert resource person, Dr. Ganesh Kenny, psychiatrist, a specialist. I'm very sure he is going to address some of the concerns that you have been facing in the last couple of months, including today. So thank you, Mr. Royal, for organizing this very timely lecture, guest lecture on the impact of online learning, its health issues. I wish all the best to this guest lecture series, and I'm very happy that Dr. Ganesh Kini is already there waiting to share his expertise. I'm very sure at the end of this guest lecture, many of your questions and your doubts that been lingering in your mind will be clarified. So thank you one and all, and wish you all the best. And thank you, Dr. Ganesh Kini, for accepting to be our resource person and addressing our young minds. So thank you.
Thank you, sir.
Thank you, Dr. Norbert Lobo, for your wonderful presidential remark. A kind reminder to all participants, all queries must be put in the chat box and will be answered at the end of the seminar. Last but not least, I request Miss Renita, the President of the IT Club Association, to introduce our guest, Dr. Ganesh Kini.
Good afternoon, everyone. It gives me immense pleasure to introduce today's resource person, Dr. Ganesh Kini, Assistant Professor of Yenepoya Medical College. Dr. Ganesh Kini has secured his MBBS degree from Kempegowda Institute of Medical Sciences, Bangalore, in the year 2008. He has completed his MD in specialization in psychiatry from Government Medical College, Kozhikode in the year 2013. He has worked in Government Medical College, Kozhikode, MS Ramaya Medical College, Bangalore, and currently he is working as Assistant Professor in Yenepoya Medical College, Mangalore. His area of expertise is psychiatry. His publications include relation between clinical and social variables and duration of untreated psychosis in first episode psychosis, treatment response in non-psychiatric versus psychiatric manias, a follow-up study from India, perception of sexual dysfunction in males with alcohol dependence, smartphone addiction among students of Medical University in South India, a cross-sectional study. On behalf of St. Aloysius College, I extend a warm welcome to you, sir, and we are eagerly waiting to listen to you. Over to you, sir.
Thank you, ma'am. Thank you, sir. Shall we start the presentation?
Yes, sir.
Yeah. So I hope my slides are visible to everyone.
Yes, sir, it's visible.
Yeah. So thank you. Sorry. At the outset, I would like to apologize to everyone. I have never used. At our center here in Yenepoya, we have generally used either Google Meet or sometimes we use Microsoft Teams for our online programs. So I'm not much familiar with the Zoom platform. So I apologize for for starting late. Nonetheless, I'll try to complete this whole session within time. So let me begin. So around roughly 1 week back, I was requested to speak on this topic: online learning, mental stress, and how to overcome. So I was at that point. I realized it's a difficult topic because this is an entirely new phenomenon, and we have hardly seen clinical populations coming to us with mental stress due to online learning. I did not know. So I'm actually like the blind man who's trying to describe the elephant. So and perhaps some of you might be disappointed with what I have to offer here, because the lot more research in this area of online learning and how it is affecting and how it is impacting our students and how it's impacting our teachers is it needs to happen. So this is a new phenomenon, and hopefully my talk I'll try to give a well-rounded picture as much as possible, and hopefully some of you get some take home points from this talk. uh, uh, Online learning has always existed earlier also. It was we had so, platforms like Coursera, MIT OpenCourseWare, and Khan Academy. Most of you know all of these massive open online courses. So it always existed, but at that particular point, it was mainly taken by individuals who were highly motivated to study, and it really didn't create that much of an issue. But right now, because of the COVID-19 pandemic and because of the lockdown and social distancing restrictions, this online learning has become much more accelerated, and it has become widespread. So I think scientists will continue to direct the government to not open the schools or colleges for maybe another year or so. Briefly, they were opened in some places, but again they have closed down. Second waves of COVID cases are increasing everywhere, especially in Europe and USA. USA made world record yesterday for 1.5 lakh cases per day. So I don't see colleges and schools opening anytime soon. Even if they do, they will be severely restricted, and a lot of restrictions will be there in place because social distancing has to be maintained. So online learning will continue to happen, and it will start impacting a certain set of students who have always had problems. So even earlier also, there were a set of students who had difficulty in learning while in regular physical classes itself, and now it will be even much more difficult. But is the picture so black and white is what I wonder sometimes, because since last 1 week I have been trying to speak to some of my students, and some of the responses that I got were slightly different. They said yes, education has changed, our lives have changed, but some of them did say that they have been enjoying the online classes. Few students told me that they found it more relaxing because uh, they don't have to face anyone, so they can straight away start talking without any hesitation. So especially students, any young people who have anxiety issues, social anxiety, fear that people will laugh at them, mock them, so it's much easier for some of them. Some of them told me that it's now easier on their pockets. They don't have to travel much. They don't have to. They just have to sit in front of a computer, and it's much more relaxing. So they don't have to worry like, oh, is someone looking at me? And okay, maybe they may be scratching their head or no. So they need not worry about such small issues. And some of them reported that they found online learning easier because they can it's they can quickly search on Google for a particular related concept. They can search in Wikipedia, and some of them did uh, say report good things about online learning. They found it much more relaxing. Certain institutions, what they're doing is they're recording the lectures, they're sending it over WhatsApp or certain other platforms like Google Classroom. So what happens is the students, if they miss a point, perhaps they zoned out during a particular lecture, they can rewind, go back, listen to the lecture again and again. So it has become easier for certain set of students, but there have been difficulties for another subset of students. Uh, so, what are the challenges that most of us are facing in e-learning, online learning? A whole set of issues, connectivity issues, low adoption rates. I was just speaking to one mother. They're poor farmers from Davangere. They grow ragi and very from low socioeconomic status, and they have completely stopped because uh, they have completely stopped education for the child because they don't have a smartphone at home. So uh, it was painful to hear that. It was heartbreaking because of COVID, that this particular child who's in fourth standard now has to stop. The education has completely come to a full stop. So and there is the computer literacy and the digital divide is there. So we just now I myself had so many issues in logging in, and uh, I did not know how to certain technical proficiencies I did not have with the certain platforms. There is difficulty in engaging with learners. I'll come to each one of them. One of the major issues that we find is connectivity issues. One thing we have to remind ourselves is we are still a developing country, and and the network coverage can be bad in certain or certain areas, and it's especially if the particular child or the student is trapped in a rural area and they are not able to move because of lockdown. We had few students like that. They could not travel during the lockdown phase, early lockdown phase, lockdown 1, lockdown 2, lockdown 3. We were having online classes, but they had already gone to their homes in rural India, and because of the connectivity issues, they could not attend to our classes. So though we continued classes during April, May, a small subset of students could not listen to the lectures because of poor connectivity. So those issues are there. And what happens is, because of the connectivity issues, sometimes if at all there is a delay in the messages coming and going, what happens is it starts affecting the students. So the student may make a comment or make a statement or ask a question, and if there's a delay, then automatically all sorts of negative things start coming into our mind. Perhaps they may feel insulted, they feel perhaps their comments are not being appreciated, and they may become more inhibited. So actually perhaps the teacher did not respond back because of connectivity issue, but the student misinterprets this connectivity issue as an insult. So all these kinds of issues can happen. And so another major issue is these platforms. There are so many platforms: Zoom, Google Meet. These are the most commonly used, but some of the colleges also use Cisco WebEx, Google Classrooms, uh, Microsoft Teams. These platforms, no matter what, they're not the education that the interaction that they're offering is not rich enough, is what I felt. I felt you're especially as a teacher that I depend very much on body language, on the emotional intonation in my voice, the cadence, and so the all these aspects are very important in conveying our classes. So half the time I don't know, I'm not able to look at my student. I'm just staring at when I'm speaking on a Zoom or Google Meet. What happens is I'm just staring at a computer. I don't know, are my students able to understand? Are they supposing if I crack a joke, did the joke land with the students? Did I make the concept easy for them? Did I not? Earlier it used to be much easier for me. I could just look at the face, I can understand, okay, this chap is perhaps feeling sleepy, that girl perhaps hasn't understood, maybe I need to give another example to make this concept clearer. uh, it's very much difficult, and the same issue uh, the students will face. At least in Zoom, there is a small window which can be of the speaker in the foreground of the slides, and but or on the slides or the screen. In Google Meet, even that is not available, so it becomes very difficult for the students also to understand. They're not able to see the speaker, they are not able to uh, the full force of the body language, the emotions, the those minor inflections, emotional inflections. So all those things are not well communicated via these platforms. uh, I I always one of my uh, 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 favorite teachers was Dr. James. He was a wonderful teacher. He was a neurologist in Calicut Medical College, and though he used to hit us and he used to shout at us, we never felt bad. That was because the way he spoke to us, he always had a smile on his face, even when he's hitting us, or even when he's shouting at us. He used to smile at us with, I mean, he used to hit us with a smile on his face. So we never felt bad. We felt, that he's perhaps intending the best for us. And so over the years I've realized uh, he was such a wonderful teacher because of his body language and how he communicates his issues. He was not mean. Even though he was shouting at us, I could sense that he was not mean to me, he was not rude. So I could connect with the teacher much more. All these issues do come into when you're speaking, no matter how good the platforms are, whether it is Zoom or Cisco WebEx or whatever. That doesn't happen. Also, what happens is, if you are constantly, since I am constantly thinking about what the students are thinking, my presentation starts coming down. It starts getting affected. You see, it's very simple. You cannot talk on the phone and drive the car at the same time. You can do that. The only thing is you'll end up in an accident. So you can either talk on the phone, or you can drive the car. When you try to do both, you'll end up in a road traffic accident. Similarly, what happens is, in all these platforms, since I'm not able to see right now, I can see that there are 319 participants. So, but I don't know whether they are able to understand. Are they able to connect to me? Are they able to understand? I can have to keep guessing their mind. So my mind gets diverted from the presentation here in front of me automatically my presentation starts suffering, and then it will become like a vicious cycle, and it will further add to my anxiety that my presentation is going bad, and then it will become a whole complete mess. uh, some of the other issues that I have faced and I have discussed with others is other teachers also, is that everyone is finding it difficult to engage students. They are finding it, teachers find it difficult to give proper feedback to the students. Parents are finding it difficult as they have to sit with the children now to make sure they are concentrating, and children find their parents intrusive. So all in all, everyone is having difficulties. Uh, but nonetheless, what we have to understand is this is the future of our education, and I don't think e-learning, online learning is going to fully stop. It'll be probably scaled down, but it won't stop fully. Now, I have been constantly now speaking about stress. I just said if connectivity issues are causing stress, these platforms, they're very poor in their nature and they're causing stress. Uh, what is this stress? Now, stress can be many things. Stress can, how does the stress present? How do you know that you are feeling stressed? The people who are experiencing stress can experience a number of symptoms. They can experience, they can be angry, hostile, restless, anxious, jumpy, sad, depressed, nervous, numb, overwhelmed, panicky. So there's a whole list of symptoms, whole lot of the whole lot of effects of stress. They can present in a whole lot of ways. So this is the whole this is just about, I've tried to cover most of the effects of this stress. How does it happen? For to understand that, to understand mental stress, you have to understand the mind body connection. Let me give you an example first. Supposing you are walking down a road, okay, and it's there is no moonlight, there is no street lights. You hear it's dark alley, it's a dark road, and you just hear some sound. Okay, you hear a sound of some leaves rustling. Now a thought will come to your mind. Is it a tiger, or is it a wolf, or something like that, some wild animal? Automatically, how will our feelings be? Automatically, I'll feel tense, I'll feel anxious. And what will happen to my body? I may start no, I might freeze, or I might just run away. Now imagine the same situation. It's a dark road, there's no street light, there's no moonlight, and I'm just walking on a road, and I hear the same sound, some leaves rustling. But this time another thought comes to my mind. Is it a cat? Is it a kitten? Most likely I'll be very calm, I won't be anxious, and I don't think so I'll try to run away. Now it is the same situation in both the conditions, in both the states. It was the same situation. The situation was, I heard the same sound in both the situations. That is the leaves of the leaves rustling, the sound of the leaves rustling. But in one situation, one particular situation, I felt anxious. In the other situation, I was very calm. In one situation, I tried to run away. In the other situation, I didn't run away. What changed? What changed was the thought that came to our mind. The thought that, oh, is it a tiger? Oh, is it a kitten? This thought is what created the anxiety, and it's that particular thought which created the running away response. So you have to understand, what you have to understand from this is that there is no tiger, there is no kitten, there's just the leaves. But our mind starts interpreting these situations in various 100 different ways. So I may start interpreting it as a tiger and I'll get scared, and if I interpret it as a kitten, I'll not get scared. So our mind will have a significant impact on our body through these thoughts. So our thoughts are our main problems. Lot of us have been having negative thoughts, especially since the onset of this pandemic, COVID-19 pandemic. No? And I'll give some common cognitive errors that most of us have. Some of us have errors like, for example, all or none thinking. Oh, I'm a complete failure because I couldn't perform even a simple task from my to-do list. Uh, uh, or some people start overgeneralization. I failed in today's exam. That means I'll never be able to pass any exam. How do you know that? Maybe you will pass. Maybe you will not pass. But this particular person starts generalizing. I failed today. That means I'm going to fail. No, every single time from now onwards. Uh, Certain people starts disqualifying the positive. No, okay. My teacher said my seminar is good, but she must be saying it because she feels sorry for me. So even if someone says good things about them, they cannot see the positive aspects. They automatically disqualify it. This is again one common thinking error, which leads to anxiety, leads to depression and stress. Certain people have certain styles of thinking like mind reading. Okay, my teacher walked out during my seminar. He must be thinking that I'm boring, that's why he walked out of the seminar. You never know that. You don't know why he walked out. You don't know why maybe he got a phone call, maybe there can be 100 reasons why he walked out. But this particular person starts, if they start mind reading, start reading the mind of the other person, they will start feeling stressed out. Or sometimes fortune telling. Okay, I know I will perform in the badly in the exam today. How do you know that? So these uh, errors in the way we think leads to our problems. So our mind starts telling us, oh, there is a tiger. So automatically we feel stressed, and we'll start becoming more inhibited, uh, and anxious, and it'll affect our performance. Now, in this case, what do? We have to keep thinking positively. Even if so, here it's very important for us to start thinking positively, irrespective of whenever we start getting these negative thoughts. If at all, even if you're not able to think positively, at least what we can try to do is not try to uh, not try to make the situation worse by constantly putting more pressure on ourselves. Oh, I shouldn't think so negatively, this is wrong. If you keep uh, putting pressure on yourself like that, the worse it will become. If I keep thinking, okay, I should not think about an elephant, the first thing that pops to your mind is an elephant. So if you keep thinking, okay, I should not think negatively, then it'll sometimes it can become even worse. So what I suggest, so what I tell most of my patients is this: imagine you are sinking in a quicksand. What do you do when you're sinking in a quicksand? The best solution is stop struggling. If you stand still, you won't sink further. But if you struggle more and more, what will happen is there's a good chance that you will sink deeper and deeper. So stop struggling against these negative thoughts. Maybe some of you can start practicing mindfulness. There are useful apps available in Play Store and App Store. Headspace app, UCLA mindfulness app. This is mindfulness is a form of meditation, where you try to become aware of these thoughts. Try not to judge them. You become aware. Okay, this is a thought of my mind. Okay, this is thought that my mind is telling me there is a tiger, but it's just there is no tiger, there is no kitten. No, is the only thing that is real is the leaves. So by practicing this meditation, you can try to become aware of these thoughts, notice these thoughts, label these particular thoughts, these mental events as thoughts. Try to become be try to be present, more present in the moment, uh, and try to accept with all kindness in a non-judgmental fashion these thoughts, and let uh, let go of any harsh judgments on yourself. So these are useful. I myself use the Headspace app sometimes. So I would suggest some of you students can perhaps use this app. Another way to beat stress is to create a to-do list, prepare a list of activities the previous night itself, because early mornings people are full of energy. So you should not waste time early morning after getting up thinking, okay, what should I do today? So the previous night itself, you make a list of activities that you need to do. Mark their importance. Okay, this is what I need to do first. Maybe this particular topic I need to study first, and maybe after that I can do some other topic. So mark their importance and assign time estimates, and be very, very realistic. One of the biggest problems that all of us face is that we are not realistic when we are creating these to-do lists. We cram in so many items onto our list that we finally end up working 16 hours, 18 hours, which is not healthy. And if not, we are not able to work 16 hours, 18 hours, then what will happen is we'll feel more stressed out the next day, that because we could not do our to-do list. So uh, be very, very realistic when you're creating this list, and schedule a time for learning every day. List a task, set an alarm for 25 minutes, work on that particular task for 25 minutes. Once you're done, you can put a check mark on the paper once the task is completed, and later you can take a break for 5 minutes. After every 4 such 25 minutes, take a longer break, perhaps for 15 to 20 minutes. So I use this technique usually. I find it difficult to concentrate for more than 20-25 minutes, so I don't stretch it. Some of you can set the alarm for 50 minutes perhaps, but I myself set it for 25 minutes. So I find it useful, and that this particular technique of learning. So always schedule a time for learning, and follow these simple steps. Never try to do any multitasking. Uh, Multitasking is a myth. Okay, let me study at the same time trying to watch IPL. It's not a good idea. What I suggest is try not to do any multitasking. As I said earlier, you can either talk on the phone or you can drive the car. If you try to do both, you'll end up in an accident. Try not to do any multitasking. Uh, One of the biggest problems when we create such lists is we, as I said, I myself have faced this. I sometimes become very unrealistic, and then I'm not able to finish my list, and subsequently in the next day I get upset. Here at this point, I would like to give another metaphor. The metaphor of the tramp. Imagine you decide, okay, I'm going to throw a party, and you put up, send invitations everywhere. There's a party here, all are welcome. So this guy, there is a tramp, there's this beggar. He decides, okay, everyone is welcome, so let me also go in there. So he goes into this home of this man, and he messes up the whole party. He spoils the mood for everyone, and everyone is upset after that, especially the host. Now, after a few days, the host decides, okay, let me throw another party this time. But this time, what this man is doing is he's constantly standing at the gate. Okay, I should make sure that that particular tramp, he should not be allowed back into this home, because last time he came into the home and he spoiled the party. So I should be very careful this time. So I should not let him in. So he's constantly standing at the gate and making sure that this particular tramp doesn't spoil the party. The problem with this whole situation is our host, he's not able to enjoy the party himself. Yes. So the point that I want to make is this, that ultimately most of us end up spending our time like this. We end up creating a problem. We end up having a problem. maybe because of our own mistake or because of several other reasons. But we spend so much time analyzing, oh, why did this happen? I think tomorrow also this will happen. Maybe this will happen. Maybe that will happen. See, maybe the beggar will come the next time into the party and maybe he will destroy the party. We don't know. Maybe he'll come, maybe he won't come. But in the process, constantly worrying about this, that he might come, he might not come, constantly worrying about this particular problem, in the whole process, the host is the loser actually. He has to constantly stand at the gate. He is constantly ending up becoming this watchman, and he's not able to enjoy his own party. So uh, the same thing happens to us. We constantly think so much about, okay, maybe I did this, I did that, okay, I should, maybe this will happen. Yesterday also I could not complete my list. Today I think today also this will happen. It may happen, it may not happen, we don't know. But constantly worrying about it, today we are wasting our time thinking about what might happen or might not happen. So I always give this example to my patients about this particular metaphor. One of the biggest problems in this particular situation, in this particular pandemic, is uh, we are all now currently cooped up inside our homes. We are feeling stressed out. Most of our us are using our devices for connecting with so many people, but it's also acting as a distraction, especially for students. So I one suggestion to all students is, try to avoid these distractions as much as possible, especially social media. And there are several reports right now which say that you know more and more teenagers are spending time on online. 7 hours roughly is per day, 550 hours a week. That comes to around 2400 hours a year. That's nearly 1/3 of the time you have in a year. So that's an incredible amount of time people are spending uh, online in front of their mobile devices or computers. And what has happened is, it has now become an even more bigger problem since the pandemic started and since the lockdown. It has become almost like an addiction. um, I read in recently in the Hindustan Times that in a study which was conducted online across 30 Indian cities, it concluded that children's addiction to electronic devices during the lockdown increased up to 3 times, as they spent nearly 5 hours a day on their favorite gadgets. So this is much more. Perhaps the earlier figure of 7 hours was an international figure, and now here in India, the figures have increased. Number of amount of time that people have spent online have increased. It is a good thing and a bad thing at the same time, and people are becoming more and more addicted to these issues. As a clinician, maybe in coming months we will see people who are getting admitted, who will come to us seeking help for internet gaming addiction or uh, Facebook addiction and things like that. What you can do is perhaps try to mute or minimize the notifications, especially when you're studying. There are all these options available. Try to limit the time you spend on particular social media apps. Most of us don't even know that such kinds of inbuilt mechanisms are there within these social media apps. I understand these are good for you. There's a whole world out there, much to learn definitely, but uh, at the same time, perhaps you can remind yourself that it's you have used enough for the day, and you can perhaps pause your social media consumption and limit yourself. So most of us don't even know that such kinds of inbuilt features are there in these apps, in these phones. So you can perhaps use all these. uh, One thing what's happened here is, most of our um, sleep patterns have become destroyed because we don't have to attend physical lectures anymore. So earlier people spent 1 hour traveling to colleges, 1 hour back. So they had to get up early, and sometimes there are, especially during lockdown, what happened was the sleep patterns of so many of us got disturbed badly. Sleep is extremely important, and especially who knows it better than the professional athletes. This particular article that I found, Roger Federer and LeBron James, they sleep an average of 12 hours. Do you know why? It's because most of them are they know the secret that if you need to perform well, you need to sleep well. Especially for an average, for an adult, I would suggest at least 8 hours of sleep, and for children, I would suggest at least 10 hours of sleep. There's an entire book on this. It's meant for, it's a popular science book. All of you can perhaps read it. It's called Why We Sleep by Matthew Walker. It's a wonderful book, and it's got lots of information. It says that it's sleeping is extremely important, especially for learning. If your learning improves, whether it is learning tennis or basketball, or if it is even learning books, learning from academic stuff, academic material, sleep improves our learning, sleep improves our memory. So try to sleep regularly, especially, and try to sleep adequately. One particular few suggestions that I would like to give to most of our students is, don't use phones in bed, don't use your mobile devices in bed. Try to sleep on time, try to get up on time. You may have your own particular set of time, but try to maintain that regularity. Inside your homes, don't try to sleep on your, don't try to read on your bed. If you're finding that your sleep patterns have disturbed because of this lockdown and the social distancing restrictions, and because of lack of physical classes, what I suggest is try to not most of us use our beds as our workspace, so try to avoid doing that. Bed is only meant for sleeping. If some of us, what they do is, we sit and watch TV in our bed, they read in their beds, they they do the work in their bed. So please avoid doing that. If you're not feeling sleepy, what I suggest is, you can take a hot water bath and come. What happens is, if you're taking a hot water bath, as soon as you come out of the bathroom, the relative to the room temperature, your body is hotter, so you'll feel cold, and this can help in inducing a sleep. Try to drink warm milk, and try avoid looking at the clock. Go to the bed, wait for 20 minutes. If you don't get a sleep, go and sit on a chair, read something really boring. When you get a sleep, go back to the bed. Sleep is something that you cannot do. You cannot make yourself sleep. It has to happen on its own. You can put food into your mouth, but you cannot get it digested. Digestion is something that happens on its own. So sleep is a natural physiological function. It will happen on its own. You can put yourself on the bed, but you cannot make yourself sleep. Sleep is something that happens naturally. So don't get stressed out that you're not getting sleep. Wait for 20 minutes. If not, sit on a chair and then when you feel sleepy, go to sleep. Okay, some simple sleep hygiene techniques is if you follow, and try avoid caffeine, any aerated drinks, any caffeinated drinks like Pepsi, Coca-Cola, coffee, especially after 6 o'clock. And these simple techniques should help you in improving your sleep quality. And as I said, sleep is very important. It will improve your memory, improve your learning. Now, regular exercise very important, because they say that it helps every group of individuals, adults, children, older adults, especially. What I suggest is 60 minutes of moderate to vigorous intensity physical activity. You can do this inside your home, or on your terrace, in your garden. If you have early morning, you can get up and you can go for a run. it's a natural mood booster. It improves the serotonin production, and it will help you in reducing your mental burden. One more thing that I want to stress is how to avoid eye strain. This is again important. A lot of people are reporting with the eye strain of late. What happens is, because you're constantly looking at the screen, you're not every 20 minutes. What I suggest is you look away for 20 seconds and try to stare at an object 20 feet up, 20 feet away. Try to illuminate your not just your screen, but also your keyboard, your books. And if you have been prescribed glasses, wear it. Try to blink frequently, and if possible, you try to use bigger screens. Most of us have been unfortunately uh, doing our most of our online learning on mobile devices. If you can cast it onto the TV or a bigger screen, it would be better. And clean your monitors, and as I said, try to use bigger fonts. It'll be useful, and this will help you in reducing eye strain. And it can sometimes eye strain can present as headaches. So they come to a psychiatrist, but usually it's saying that they have been feeling stressed and they have a headache, but mostly it is perhaps due to eye strain. So frequent blinking is very important. Frequently looking every 20 minutes. Follow this 20-20-20 rule. Every 20 minutes, break for 20 seconds, look at an object 20 feet away. And always try to seek help from, don't feel free, try to seek help from adults, try to seek help from your parents, from your teachers. Try to take feedback as much as possible. It's very important, especially in India. This culture of seeking help is not there, especially with students, so they feel very much inhibited. You should start seeking help, especially earlier, at least in physical classrooms, we would directly get feedback from our teachers. But nowadays, this digital divide is creating problems. So feel free, try to seek help as much as possible wherever necessary. If need, try to go on a digital detox once in a while, especially over the weekends. This will be much useful. To summarize, try to meditate, mindfulness meditation, get regular exercise, sleep well, try to connect with your friends, and eat well, and reduce caffeine intake. It's not good. And try to make lists and prioritize your tasks. Okay. With that, I would like to conclude my talk. Thank you.
Thank you, sir, for this online guest lecture.
So any students who are having questions, you're free to ask now. You can use the chat box and you can type the questions. Anyone would like to ask any question?
Yeah, there's a question from Hisham. So making a schedule is good idea, but the next day we have to most probably change it, because the next day we are supposed to complete other immediate task. Okay, what's the solution for this? Yeah, as I said, so perhaps that means that you're not being realistic in how you create a list is what you need to understand. So that means that if some people do that, okay, today I could not complete this task, let me do it tomorrow. Then from tomorrow it goes to the day after. That means that there's some issue there. You're not being realistic enough in how you plan your task, and how you either you, the amount of time that is being allotted is not enough, or there are some other issues with that particular task in general. So you need to look at you need to start analyzing that. I hope I have answered your question. There's one more question. How shall we overcome something that we tend to overthinking every time rather than accept the reality? Okay, overthinking. Yeah, that's what I said. Sometimes yeah. sometimes we tend to overthink these things. As I said, with the tramp metaphor, we constantly think, oh, maybe this will happen, maybe that will happen, maybe why did I do this, why did I do that, why did I allow that particular tramp into my house, I shouldn't have allowed, maybe he'll come again, maybe he'll come tomorrow to my party. In the whole process of thinking, either we are living in the past or we are living in the future. Try to recognize these thoughts as thoughts. These particular thoughts is they are creations of our mind, is what you have to realize. you know uh, they are not real. So it's like the tiger. Our mind is telling us uh, there is a tiger, okay, there is a kitten, but they're not real. The only thing that is real is uh, the leaf. The only thing that was real is the leaf. You have to realize that this particular this thought that, okay, maybe I did something wrong, why is this happening to me, why am I not able to study, uh, or maybe I'm useless, maybe I will fail, maybe that will happen, maybe this will happen. This is a thought. So thoughts are not real. The only thing that is real, the thoughts are like that particular thought, is like the tiger. There is no tiger there. It's not a real thing. So you have to understand that this is a particular thought and it cannot affect you. Once you realize that it's a thought, you'll become calm. Once you realize that that there is no tiger, you'll become calmer. I hope I made sense to Mr. Monteiro. I'm sorry. Yeah. Okay. There's a.
Sir, in general, I would like to ask one question.
Yeah.
Now, students are registered for our online teaching or online learning. Now, when they come back to offline classes, they have to come regularly to the classes and they have to attend the classes, and again they will go back to the old methodology. Now, how they can adjust immediately? How they can adjust to this environment, sir? Do you have any suggestions?
I think uh, some people may love it. As I said, I've been for the last 1 week. I've been trying to speak to my students. Some people have been loving online learning. Some people have not been loving. So there are various issues are there. Some people liked it because they're generally anxious people. So sitting in front of a computer made it easier for them. I don't think so. It should be an issue for them to come back to physical classes because that's what they have been doing all their life. So online learning is what's the difficulty, because it's like trying to learn uh, to ride a bicycle. So we all make mistakes. Today also you saw I also made a mistake. I mean, not a mistake exactly, but I did not know how to do it. So we'll all perhaps have difficulties. Somehow our students have been able to cope. But coming back to physical classes, it should not be an issue. The issue is the restrictions that governments will force. Governments may perhaps say, okay, you can allow only these many students. You have to sit far away. Here, students are missing the particular peer-to-peer learning. The peer interactions they are missing. The closeness, the bonding. Those things that are missing. I think physical classes will be welcomed by most of our students. I'm not sure how our students feel about coming back to class. Yes, Manish, I understand lack of social contact is very stressful. Unfortunately, we are all in the same boat, same mess right now. Even I have not met most of my friends for the last 8 months. We are all finding it difficult. I try to keep in touch with my friends through just like most of you do, through phone. I keep calling them, and I've been trying to get in touch with them. It has been really stressful, unfortunately.
So since we have lack of time, sir, we will stop here now. Suppose if there are any queries, I'll personally collect the queries from the students and I'll forward it to you.
Sure, sure. Thank you.
Thank you, sir.
Thank you.
I would like to call upon Alistair D'Souza from the Quiz Association to give a vote of thanks.
Good afternoon, everyone. It gives me an immense pleasure to deliver the vote of thanks for today's session. First and foremost, I'd like to thank the principal, Reverend Dr. Praveen Martis SJ, for his support and guidance. We have been fortunate enough to be assisted by our ECCC coordinator, Mr. Ashok M. Prasad. You have been a constant support to all of us. Thank you, sir. I'd like to thank the Yenepoya Rural Healthcare Center Director, Dr. Poonam, for giving us this opportunity to organize this guest talk. Thank you. I thank the medical officer of Yenepoya Rural Healthcare Center, Dr. Srinivas, Sister Divya and Swikriti for your support. On behalf of the college management and all the participants, I'd like to thank our resource person, Dr. Ganesh Kini, for making an excellent presentation and making this guest talk very meaningful and informative. I would also like to thank the Director of Admin Block, Dr. Norbert Sir, for his presidential address and support. I would like to thank Royal Sir for helping us organize this webinar. I would also like to thank today's MC, Sherlyn Fernandez, for mastering this guest talk in a wonderful manner. I thank the IT Club and Department of Computer Science, Application and Animation for initiating to organize this guest talk. Finally, I'd like to thank all the presidents of the various associations, namely IT Club, Quiz, Red Cross, Computer Animation, Heritage Club, and Wikipedia, the secretaries of the following associations, and all the students present here for being a part of this talk. Thank you, everyone.
Thank you, Alistair, and everyone who's gathered here. Now, the attendance and feedback form will be posted. Kindly note, participants, mention your year, your course, section, and which association you belong to, if any. I repeat, kindly note, mention your year, your course, your section, and which association you belong to, if any. Thank you once again, and have a great day.